I am here to talk about Crises. This is a block of acrylic being injected with 5 million volts of electricity. I've responded to more than 24 public health emergencies and disasters, mostly in a United States context. This is what it's like when a community faces a disaster. It's like that community was struck by lightning. And what that means to me, as I see it, is that each community member, each individual, apart from the tragedy of that disaster, feels this upswelling of emotion and energy. It's like a light that circles around them. They want to connect with each other. They want to help to resolve the pain that's embedded in their community. My co-author and I, in our book coming out later this year, call this disaster natality. Now, the beautiful thing about disaster natality is that it scales. As you have more and more people, neighborhoods, groups feeling this connection to each other, it creates a power across the urban environment. It's a kind of social immune system that helps your entire city respond. Now, we saw this in spades during COVID, didn't we? Let's celebrate the good stuff. More than 20 million excess deaths were prevented by our vaccine efforts alone. That's a massive win. And our lives have changed in ways that we will not return from. Whether that's telework, whether that's e-commerce, whether that's online learning, we're not going back. But as a globe, we didn't just innovate technologically, we also innovated socially. Did you know that in the first 90 days of COVID-19, more than 4,000 mutual aid groups were founded in the United Kingdom alone? All over the world, especially where governments didn't provide adequate social support services, neighbors stepped up to help each other. They provided themselves food, housing, financial assistance to help their communities survive. But not just that, also hyper-local manufacturing capabilities. They used 3D printers to make masks and swabs and ventilators to meet needs in their areas. It's amazing. We innovated in amazing ways across the world. But of course, it wasn't enough. Right? The latest numbers show that there were more than 15 million excess deaths due to COVID. At least 1 million of those due to vaccine hoarding by richer countries, according to some of the latest models. And we saw misinformation and disinformation spiral all over the place. Some of you are probably sitting out there right now thinking, what do you mean that crises create solidarity and connection? What I see is a world where crisis after crisis are pulling us apart. In my own country, we saw protests against masks and vaccine transition directly into political violence. Luke Vogelson and other journalists chronicled that day by day. Same protesters in both sets of protests, anti-masks, political violence, one-to-one. So how can I say that crisis breeds solidarity? The fact is, disaster natality, this upswelling of emotion, is fractal. This is the same block of acrylic with the lightning injected into it. It's fractal, meaning that because it's a new feeling that you face in a disaster, you're searching for meaning, you're searching for connection, that process can go both ways. It can lead you towards better societies, and it can also take you to some dark, dark places. It depends on how you manage it in the moment. Let me give you 2 examples. In 1904, Johannesburg, South Africa, faced a plague outbreak. And the city leaders did something that all the newspapers said was incredibly innovative, incredibly new advanced technology. They made new, brand spanking new, clean quarantine and isolation facilities just outside of town, and they moved a big chunk of their population to those facilities to prevent disease spread. The people they moved happened to be Black South Africans. The name of that camp was Klipspruit. Later it was called Pimville, and eventually it was named Soweto. The historian Howard Phillips has traced apartheid in South Africa directly back to those public health interventions undertaken in 1904. That's a terrifying thought for any of us involved in global health. On the other hand, after the 1918 pandemic, the historian Laura Spinney showed that it was that experience of a collective community coming together, seeing the horror the pandemic caused, that led to socialized medicine. Healthcare for all started in the aftermath of this pandemic. She traces the German healthcare system, the National Health Service in the UK, directly to those pandemic experiences. It doesn't just matter that we innovate in disasters and public health emergencies. It matters how we innovate. Fractal patterns. We can go one way or the other. We are going to face, in the next decades, a mounting series of crises. Complex humanitarian crises, public health emergencies driven by climate change, obviously future pandemics, disease X, Y, probably Z also. And it matters how we innovate through those crises. We will see amazing things. We will see diagnostic tools, PCR tests that you can fit in the palm of your hand that artificial intelligences will analyze. We will see drones that can send directed supplies to targeted locations in disasters. We will see augmented reality tools that help us do disaster reconnaissance more efficiently and effectively. We will see targeted medical treatments based on individual genetic sequences. Many of these things we've talked about in the last 2 days. These are amazing technologies, but they have a danger, which is that they can treat people as isolated individuals. Individual patients who are alone in responding to a crisis. And the reason that that's dangerous is because it threatens to break the disaster natality that we need. It threatens to break the solidarity that people feel in crisis. And what that could do is destroy the social immune system that our cities rely on when they come together during crises. You following me? I like to check in. So the anthropologist Christopher Dyer has chronicled this over time. And unfortunately, what he says is that when we respond to disasters like this, technologically, but not thinking about social cohesion, over time they make communities more corrosive. Eventually, they will cease to function as a society, disaster after disaster, and that's going to be our lives for the next few decades. On the other hand, optimistically, he says that if you can respond to these crises in the right ways, by pairing innovation and resources with activities that build solidarity, you can achieve something called the Phoenix effect, where cities can leap forward both technologically and socially at the same time. That is our job as public health professionals around the globe, to find this pathway through the fractals that will increase technological innovation and increase solidarity at the same time. So, how do we do that? I would encourage you not to think about smart cities, but to think about fractal cities. All the technologies we think of for smart cities and urban health, biosensors and walkability, Internet of Things, all that stuff, are important advances. But we can't think of a city as a unified command and control environment. It is not one thing that we can organize and manage. A city, as I understand it, is made up of lots of different fractal communities, private sectors, public sectors, civil society, neighborhoods, all of which are living and growing together in like a garden, as one organism, all of which will surge their solidarity to respond to a disaster. Our job is not to command that activity, but to nurture it. To nurture the solidarity inherent in each of those communities through technology to create an emergent response network that will protect all of our citizens. I want to give you 4 specific ways that I think technology can help us do that over the next few years. First, federated learning. One thing everybody's doing now is we're building databases, right? Data warehouses. I heard of data lakes recently, data oceans, data everything. And the problem is that we're trying to gather all this data into one place, and it's hackable. It creates security problems. It can lower public trust in an era where public trust in government is hovering around 50% on a good day. And it never answers the questions we need because the data that we really want is always just out of reach, right? Somebody else has it. It's always just around the corner. Here's how federated learning works. You create a machine learning model on a centralized server, and you teach it to answer the questions that you want to answer. Are people checking on each other during extreme heat? How are transportation patterns impacting disease spreads? And then you connect it to a whole bunch of client machine learning models that are connected to a whole bunch of separate data owned by private sector partners, governments, civil societies, neighborhood groups, everybody. When you ask the central server that question, it queries all of those separate data sets. They, in turn, analyze the data they have and pull the insights together. In the end, it looks as if you were able to access all of those underlying data to answer your questions. But, in fact, those data remain secure. Each fractal is protected, but you as an analyst have context across the whole. This is a real benefit that artificial intelligence is bringing us. Second, pro-social design for public health. We've heard for years now that social media is spreading misinformation and disinformation. And it's not a matter of regulation. It's not bad actors. At this point, we know it's a design flaw. These systems are created to spread conflict. That's the incentive structure, because conflict creates clicks. So that's one problem. The second problem is that the systems we are starting to rely on in healthcare and public health are based on some of the same incentive structures. That is electronic health records and project management tools. There's a new study about EHRs just last year that showed that EHR rollout actually decreased mutual understanding of the patients and increased silos between medical departments. Why is that? It's because of the incentive structures. EHRs are built to incentivize efficiency and not collaboration. And just like social media, they incentivize feeling right over achieving mutual understanding. That's a real problem. So we need to lean on pro-social design. And by that I mean things like the application Polis, software that has built into it the idea that you have to reflect back somebody else's position, that you have to achieve a reasonable compromise. These things are pro-social design tools. We have to face the fact that public health is not going to win the misinformation war on Facebook or X or whatever, because they're stacked against us. Instead, we want to embed pro-social communication tools in each of the fractals within our cities as a way to increase truth in our environment. Two more, using existing networks of care with new technology. In my country, unfortunately, when we respond to disaster, it's often a way that elites can take resources back because we outsource everything. We get big companies to do housing and feeding and vaccination. They take all the money. The impacted communities are left less worse off sometimes. What I would argue is that we should use the existing networks in those neighborhoods to perform the services with the technology. Give the impacted community the technologies they need to perform vaccination, do contact tracing, do drone operation in emergencies. These are three things that are often outsourced, but the data shows they're done better when they're done by people embedded in impacted communities. And they don't take a lot of training. You can train someone in 2 or 3 days to do most of those things. Obviously, you need clinical resources for vaccination directly. When you do that, it surges the natality in these impacted communities. It lets them help each other. It provides crucial workforce development and economic opportunity. It takes some of the burden off the public sector, and it prevents corporations from siphoning off resources. It's a win everywhere, and the technology gets distributed further. And finally, in a federated learning environment, you can still compile all the data. It's a magical blend of opportunities. Last point, tech transfer. We are now facing more and more global disasters, but we have not figured out how to scale our technology globally. We saw that cruelly in COVID. Think about the South African vaccine transfer hub. Do you guys know this story? It was announced in 2021, launched in 2023, but by the time it's operational, it's outdated. It's taken too long to get it up. We've got to be faster, but we don't know what technologies we need. However, what we do know is what it takes to build an innovative ecosystem. We should right now name certain urban areas around the world dedicated tech transfer hubs for crises. And we need to feed them with the things you need to innovate: a skilled workforce, business support services, financial regulations, space, universities. When you create that environment, you let them improvise during a disaster. Whatever the technology is, that city is ready to do tech transfer in a number of different ways because it has an underlying technological ecosystem. That is going to be crucially important because we don't know what disasters will hit us. We have to be ready for all of them. Finally, these 4 ideas, federated learning, pro-social design in health, mobile tech transfer, using existing networks for technology distribution, they just scratch the surface. of what's needed. And I want to be clear, I'm very supportive of advanced technology in public health response. At the New York City Pandemic Response Institute, we're funding with Amazon research into how artificial intelligence will help public health response. Many of these images I made with Google Gemini, just building on the AI image wave that we're on. But we need to make sure that we build a public health crisis response where innovation is put in service of disaster natality to move communities away from the devastations of corrosion and towards this phoenix effect that Christopher Dyer predicted. In the next decades, we're going to see all kinds of amazing innovations. It is going to be incredible, but only solidarity-driven innovation, at the end of the day, will ever lead to human flourishing. Thank you so much.